Hi, I'm Tiffany Helberg, Vice President for Communications at Community Health of South Florida. We're so pleased that you joined us for this Black History Month special as we're focusing on mental health in the Black community. Today we have our Vice President and Chief Behavioral Health Officer, Jean-Pierre, with us.
Good afternoon, Tiffany, and thank you for having me this afternoon.
Good afternoon. Thank you for being here. Jean-Pierre, when we look at the state of affairs of mental health in the Black community, there's so many things that factor in, from inequities, from social justice, from the Black Lives Matter movement to economics and the pandemic. Are all of these things in fact factors, and how do they play a role?
I think all of those factors definitely play a role, Tiffany. In the last 24 months, we've actually seen an uptick in patients requesting behavioral health services, where other health services have seen some declines. I think all of those factors have impacted. Individuals have been isolated. Individuals have started to suffer from depression. Individuals have lost jobs. There's been several socioeconomic factors that have actually impacted the African American community.
Do you think that, I know you said you've seen an uptick here at CHI, but is that an accurate picture of all the people that need help? Is there a stigma associated with mental health in the Black community?
Definitely. I think receiving behavioral health services can somewhat be frowned upon in the African American community. The pandemic has enabled us to expand our telehealth services, where patients can actually see a doctor, therapist, a clinician from the comfort of their own home. If they're not comfortable seeing the clinician at home, they can actually come here on site and see a provider.
And we have it for both adults and children.
Adults and children, and most recently, strictly telephonic services have been approved for a long-term basis.
All interesting factors. So if I have a loved one who I suspect might have mental health challenges, what sort of things should I look for, and what should I do about it?
You should look for different changes in attitude, mood swings, change in your daily behaviors, maybe loss of appetite, loss of sleep, decreased interest in personal hygiene, isolation. All of those are some things that we would definitely want to keep a close eye on if we had some particular concerns about one of our loved ones.
We know that historically African Americans have been more apt to seek help within the church rather than from a clinician. How do we bridge that gap?
I think the churches in African American community play a phenomenal role, and I think as a community health center, we have the opportunity to partner with our spiritual leaders and actually participate in some of the activities their congregation may be having, such as health fairs and different outreach activities. This enables us to present a service to those individuals and educate individuals on the importance of behavioral health.
All good things. Also, we know that historically there's somewhat of a mistrust in the African American community of the medical field sometimes. How do we encourage people to get culturally competent mental health care?
Well, I think here at CHI we're extremely privileged. We have clinicians from all race, creed, and ethnic backgrounds. So patients actually have the opportunity to peruse our website and potentially pick a provider that they feel they maybe establish rapport with during their encounter, during their patient visit.
JP, thank you so much for all that great information. We encourage you to seek help at Community Health of South Florida. You can visit our website and make an appointment at chisouthfl.org, or you can call us at 786-272-2100.